My name is Dr. Chris Sakowski, and I am an orthopedic surgeon specializing in foot and ankle reconstruction with Texas Orthopedic Associates. When we talk about ankle sprains, the majority of patients get better without any type of surgical intervention, but a small subset of patients end up with ankle instability. These are the patients that will continue to roll their ankle despite using braces and doing therapy. And oftentimes this prevents them from playing the sports that they like to participate in. So particularly in my younger and athletic population, one of the more common surgeries that we perform is surgery for ankle instability. So what happens essentially when you sprain your ankle, you have these ligaments over here going from the fibula bone down into the talus bone and down into the calcaneus bone. When the ankle is sprained like this, those ligaments get torn. Patients with chronic ankle instability, the ones that keep spraining their ankle, those ligaments heal in a stretched out position so they're not functional. So what we do is a small incision over the outside of the ankle. We go in and repair those ligaments back to the bone with some anchors from a company called Orthopedic. I use the fiber tack anchors, which are super low profile. It's a very, very small drill bit, so I don't have to worry as much about any type of bone loss in the fibula when I drill. And they're all suture anchored, which is very, very strong. It gives me a good repair of the tissue. I also augment that with something called the Orthopedic internal brace, which is another anchor which is drilled into the talus bone and the fibula with a very strong suture tape, is what it's called, that overlies the ligament repair. I like the internal brace because it allows me to rehab my patients much faster. Typically, most of my high school athletes are back to playing sports between the 8 and 10 week mark post-op.